Welcome to KDRTV Diaspora Dive. We are going to dive deep into topics that affect immigrants and, more importantly, empower diasporans in the United States, Africa, and across the globe. I welcome you this November 1st to our discussion on the COVID-19 virus that needs no introduction. Currently, according to the CDC coronavirus cases, there are 9,402,590 people affected with coronaviruses. And it has actually resulted to almost 230,000 of deaths in the US today. Our team at KDRTV urges you to follow the CDC guidelines on social distancing to ensure the safety and well-being of your family. This morning, we would love to dive deeper into exactly COVID-19 and, more importantly, how to cope with the symptoms of this deadly disease. In a few moments, I'll be introducing you to our guests who are COVID-19 survivors, who will be shedding more light on how they fought and conquered this devastating virus. The report of African immigrants that most of them are actually affected due to some underlying causes. So what I can actually tell you is that African Americans are infected with COVID-19 close to 3 times the rate of white Americans, according to a newly revealed document from the National Urban League. The state of the Black America, the infection rate is 62% per 10,000, compared with 23% per 10,000 for whites. Latinos see even more infections at 73 per 10,000. The report was based on data from Johns Hopkins University, which shows that Black Americans are twice as likely to die from the virus. Why is this so? Somebody might be asking. We can outline thousands of reasons why African Americans are disproportionately affected by COVID-19. KDRTV's exclusive report found that African Americans are the largest race group working in the so-called essential industries or services, such as nursing homes, in the healthcare, the grocery store, mass transit, where COVID-19 has been proven to spread in immense ways. As people working in these essential jobs are more likely to come into contact with people who are sick with COVID-19. Unlike other jobs, some people work from home. These industries can't do as in the United States economy. This industry can't do as the United States economy will crash, with the added disadvantage that these jobs are often poorly paid, and a large proportion of such workers lack healthcare or life insurance. These and many more factors have caused COVID-19 to spread, not only infecting but killing thousands of African Americans in horrific ways. Today, we will be bringing our sisters who ferociously fought COVID-19 and managed to beat COVID-19. One of them is Sister Edith Moronge. You can see them on the screen, and Sister Neema Mura. Welcome to KDRTV, my sisters. How are you doing today?
Well, we're good. I'm good.
Thank you very much. Good. Thank you very much, my sisters. I appreciate your time, and I appreciate your dedication to come and discuss and tell the world exactly how you managed to fight this scourge and beat it. So the first question goes to Sister Edith. Okay, before the first question, I would love you to have a brief introduction. So let's start with our elder sister. Sister Nema Mura, please, can you introduce yourself?
Hello, everybody. Thank you, Mr. Gutwa. My name is Nema Mura. I'm from Kenya originally, now living in the United States, mother of 6 and grandchildren. I work at a hospital as a caregiver, although not a direct caregiver.
Thank you very much. Same introduction, a brief introduction to Sister Edith. Go ahead.
Well, Mr. Gutwa, thank you for having me. My name is Edith Kerubo Moronge. I am a mother. I have 2 sons. I'm a wife, and I'm a registered nurse. I work in a hospital. I can say that that's it really for now. I'm a nurse, mother, wife.
Thank you very much, Sister Edith and Mora. What I would like also to tell our people, especially who are watching across the globe, people are watching from Africa, and to be very specific, people are watching from Tanzania, people are watching from Uganda, people are watching from Nigeria, people are watching from Kenya. And to be very specific again, I've actually, 2 days ago, I lost a very close friend of mine, who was an orthopedic surgeon, a senior orthopedic surgeon, Dr. Daniel Alushula. I worked with him for so many years in Western Province. So he actually died. And right now, his wife and son are also battling COVID-19 in the ICU in a city called Kisumu in western part of Kenya. Not only that, even in diaspora, we also lost 3 of our community members. One was called Dr. Hume, the other was called Dr. Nyambane, and the other one was called Dr. Mteshi. So COVID is a real threat to our society. So to dive now to the scope, let's now have the first question going to Sister Edith. How did you realize that you are infected infected by this coronavirus that has so far claimed over 1 million lives as of today?
Well, I work in healthcare, like I said, I'm a nurse. So August 1st, I worked with a patient who was COVID positive. At that point, I didn't know because my unit is not a COVID related unit, you know. So patients come there for other issues. It's a mental health unit. So I took care of a patient, and it turned out to be positive. He was not wearing a mask. I mean,
on the other side.
Obviously I was wearing my mask. And so on the 2nd, I believe that's when we had the Mwanyagetinga elections. But then on the 3rd, I woke up feeling a little chilly and a bit of nausea, and I felt like vomiting. I had these malaria-like symptoms, and I was like, oh, I mean, I can't have malaria. I'm in the US, I haven't traveled. So I knew that I don't have malaria for sure, but it didn't hit me that I might have COVID because the way I was operating, at least up until that time, I'd just come home, go to work, come back home, go to work. I wasn't even going to the stores or anything like that. So I remember about the 3rd, when I woke up feeling a little bit sick, I was like, oh, I might actually be sick. The next day I was meant to go to work. I called in, I said, I can't come to work because I don't feel too good. And then it's interesting that after I'd told my manager I wasn't going to go to work, that's when she sent me an email saying that I may have been exposed. Then I was like, oh, so she told me I took care of a patient who turned out to be positive. The thing is, our patients come to our unit after they've been checked. So the results take really long. I wish the results were coming out faster. So that's how I got that's how I got exposed to COVID-19, you know, taking care of a patient who is not willing to wear a mask. And, you know, we can't force patients to wear masks if they don't want to. So November 3rd, I suspected. November 4th, I was told I was exposed. By the time I was getting my test, it was November. Sorry, I have my dates wrong. I'm talking about August. So August 6th, I did my test, and then by August 8th, my results were out. Unfortunately, it's the same day as my son's birthday. So that's when I got my results. And by then I was getting really sick, just mostly really just low-grade fever, nausea, loss of appetite, and my sense of smell was beginning to go. I wasn't exactly coughing actually at that point, but yeah, that's my story for how I got COVID.
Okay, same question to Sister Mora. How did you realize that you're infected by this pandemic, by this coronavirus pandemic? And give us a brief story on how you realized that you had it.
Well, it was way back in April, and interesting. We work at the same place together with Edith, but we all got sick at different times. When she was sick, I wasn't even, I was on sick leave. I was at home. So in April, I was feeling real chilly and having like some muscle aches on my back. And so I told Edith, Edith, I don't feel good. Can you get a warm pack and put it on my back? Because my back is really hurting. But the way it was hurting was different from any way, any hurt I've ever felt. It was like pulling and stretching, and it felt different. So Edith brought a warm pack, put it on my back. We all wear masks. Everybody wears a mask at work. So as the day continued, I began feeling chilly. My temperature was up. It was, I think, 100.6. And at that point, I talked to the church nurse, and he told me to call. We have a place to call when somebody's feeling unwell, especially at this time of COVID-19. I think it's employee health. So I called employee health, and they said those are looking like signs for COVID, so we'll let you go home. So I came home, and when I came home, I was really feeling chilly. I have a thermometer at home, and I took my temperature. It was still high, and contacted my doctor. He said to take Tylenol. That's what I did. And actually, after 2 days, the temperature was gone down. My headaches, I also had some slight headaches. The headaches disappeared, but the muscle aches, I think, continued for about 4 days. And those also subsided. Yeah, so that's how I realized that I had COVID-19. So after I got home, I was told to go for a test to see if that's what I really had. And the test came after 3 days, and they said I was positive for COVID.
Thank you very much. At least you've gone to the second question I wanted to ask you guys, but I'll now ask this question our Sister Edith. So Sister Edith, what were the symptoms that gave you a strong indication that you are infected by the deadly virus?
That's funny because everything happened in stages. There was the doubt because I kept telling myself that I was not exposed to anyone. So, in my house, no one was sick. But I think when I spoke to, I believe I spoke to Neema, and then I also spoke to my other friend in a different state. And they said, oh my gosh, you'd better get checked. That is the first time before I even got in touch with my manager to say that I might be sick. So just the chills and the malaria-like feeling. So they were like, that is COVID. That's what most people have been saying, at least people from Africa who understand malaria. They said, if you have malaria, that is now COVID. Then that's when I knew for sure that most likely I was. But I think what was bugging me is where exactly it is that I got exposed. my manager said, identified the patient I took care of as having been positive, then I knew for sure that I was. Even by the time I was going to do my test on August 6th, I knew the result was going to be positive. So it's just that malaria-like feeling that made me, at least with confirmation from others who had, who knew about COVID, that I knew that most likely it was going to be positive.
Thank you very much. Sister Mora, you have a family. How did the news of you testing positive affect them, and what exactly did you do to prevent them from getting it?
What we did initially when the rumors of COVID started, we decided just to do distancing here at home. We stopped hugs. I live with my grandkids, and so we had to tell them no hugs, and they complied, which was great. So when I come, and even my daughter lives with me, and we said, you sit at a distance and I sit at a distance. We all work in hospitals, work with patients, so we don't really want to get it and spread it. So that part truly helped. And after I realized that I was positive, I had to put a mask. I stayed mostly upstairs in my bedroom if I didn't need to do anything. If I went downstairs for food, I always had a mask on.
Wow. So, what about you, Edith? How did this? How did you testing positive actually affect your family? You've said you've got young children and a husband. So, how did it affect them also? And what did you do? What did you do to prevent it? Prevent them from getting it.
Well, the very first time when I woke up feeling a little chilly, I knew for sure that even though I wasn't sure that it was COVID, I knew that I had to keep my distance. I moved to a different room and I had to mask in the house. I had to use my mask in the house, and I told my kids no hugging. But you can imagine me getting my COVID results on my son's birthday, it was gonna turn 8 on August 8th. So it was really, really, really supposed to be like a big deal for him. Even though we were not going to have people come over, we were not going to celebrate outside. We were just going to get a cake, eat in the house. But then it was terrifying to my kids. We had recently had a loss in the family, so death is still traumatizing to them. So my little one was like, "Mom, are you going to die?" I was like, "No, I am not going to die." Then, CNN has these numbers of people dying every day and the numbers increasing and all that. So I had to tell them that I am not going to die. Did I know that I was not going to die? Of course I didn't know that I was going to survive, because you don't know, you don't know. So my kids were really, really, really terrified. And but we did do I told them that there's no more hugging, no sitting with me. I actually had to double mask myself, taking more precautions in the house, but making sure that I'm not like close to them. Physical distance at all times. They had to talk to me from a distance and all that. So that's what we had to do. It is a terrifying experience because as it is right now, there is no guarantee that if you get COVID, no matter what your age is or what your non-pre-existing condition status is, that you will not die, So it is very scary. It is very scary. And it was for my family, yes. My husband, well, maybe he was optimistic, but my kids were very terrified.
So as we are continuing to have this discussion here, it seems like, there are so many people still affected by COVID, but masks do prevent transmission in a huge percentage. We don't know exactly what's the percentage, but if you had it, you have your children, you have your family in the house, and both of you have actually said that you kept social distancing, you had your masks on all the time. That's pretty encouraging that at least having a mask, you can actually prevent it you can prevent from the transmission of the COVID-19 virus. That's very encouraging.
Mm-hmm.
Okay, now
It
the
is,
other...
masks are very important.
Wonderful. Oh, go ahead, Edith. Go ahead.
No, I was saying masks are very important. And I think what most people miss is they think like a mask is supposed to prevent you from catching COVID. Well, it will prevent you from catching COVID, but more than anything, it's going to prevent people who may otherwise be asymptomatic, who might actually have COVID, who are the biggest number of people transmitting unknowingly, from spreading it. Because what it does, it blocks your your saliva and everything from coming out. So that's why it's really important. Most people are like, I don't have COVID, but you don't know, because you could be asymptomatic and you could be spreading it. So masks will help to prevent the spread as much as it helps to prevent you from actually getting it.
Do you have something to add on top of that, Sister Momora?
I just think that, yeah, the masks are very, very important because I think I didn't. You had asked the question previously how that affected my family.
Yes,
Actually,
you
my
did
people,
answer.
my people were terrified. My mother would call me
Sure. Go
like
ahead.
every 2 hours. So those masks, I think, are very, very, very important because I believe that I may have contracted it from either a co-worker or a friend that also was asymptomatic. And so had we had masks, probably I wouldn't have gotten the infection. So PPEs, or especially the mask, is like it's a must. This is something you have to wear wherever you are, wherever you are going, especially if you are going to interact. You have to have the mask on.
Thank you. So my other question is, what treatment or precautionary measures did your primary health care recommend to you guys? Let's start with Edith.
Of course, symptoms are. In my case, I just had to be on antipyretics. Those are the fever-reducing medications like ibuprofen, and the first thing that I did actually is put myself on aspirin. My doctor did not recommend it, and anything I'm going to say is not professional advice to anyone who's listening right now. So, of course, the thing that my doctor wanted me to do is just take Tylenol, because I also did have a slight headache, and Tylenol is also going to reduce your fever. So I was interchanging Tylenol, ibuprofen, but I did put myself on aspirin because I know that even though my doctor was like, "Oh, you are in the low vulnerable group, you're low risk." My low risk vulnerability, because I don't have pre-existing conditions and my age. So they said just take the fever down. So all I could take was Tylenol. But I did put myself on aspirin and loads of vitamin C. So I had to take vitamin C every day. So I did the ginger and I did the lemon, not because the doctor asked me to, but because I wanted to make sure that my immune system is in a place where it can fight the virus. So I think, again, like whatever doctors will recommend will be based on how you're feeling. So mine was just the fever, which wasn't too much actually. The highest temperature I remember I had was maybe 100.1. Most of the time it was low grade fever, 99.8, 99.7. And so there isn't much that the doctors recommended, and they're not going to tell you to come into the hospital when you don't have what they consider as serious, like shortness of breath. That's the one they'll probably want you to go in right away so they can put you on oxygen. And at the end of the day, most people end up just staying at home and not going into the hospital, at least from the numbers that we are seeing. But those who end up getting very sick must, of course, go in. So the doctor will always just ask you questions like, how are you feeling? And based on your symptoms, that's really what they'll base their what the treatment they think you're supposed to have on, you know. So mine was just Tylenol. That's all they asked me to take.
Thank you very much for that experience. Okay, now let's come to Sister Neema. What exactly did your physicians, or which precautions did you take actually to ensure that you beat COVID?
I think the first and foremost, the physician only recommended Tylenol unless I felt like I am having breathing problems. But I have pre-existing conditions, and that was kind of a scare to me. But I must thank God for my oldest daughter. 2010, she told me, Mom, you have to be on vitamin C and D throughout. She swears by the vitamin C and D. And so I started my vites in 2010, and I have always taken those vitamins. So the way I feel like because of that, I was able to beat COVID-19 despite having pre-existing conditions. Mine was really a mild one, I can say, because after 4 days, I was already feeling okay. After 1 week, I was completely okay. I only had to stay at home and finish the quarantine. And again, when COVID-19 started, there was, people text, do this, do that, do. So we made all those concoctions of ginger, garlic, whatever it was, lemons, lime, whatever it was. I had a whole bottle. So I took that morning, lunch, evening. I took zinc. And so I felt like, and my doctor did mention that my body was fighting real well. He was kind of wondering how I was going to fight that, having some pre-existing conditions. But I think that taking care of myself, taking vitamins, has truly helped me get through this.
Thank you very much. So how long did it take you to know that you've recovered, and what have you done ever since? Let's start with Edith.
With the fact that you don't actually get a second test. Initially, they used to do a second test, I believe, to verify that you're COVID negative. But then in August, when I was sick, they said, I believe the CDC had adjusted that. As long as you did not feel like you had any symptoms, which for me was about maybe 6 days, 7 days later, they tell you that isolate for 10 days for sure. And then after that, if you don't have any symptoms at all, the assumption is that you're no longer contagious, you're no longer spreading the virus. Well, my disappointment is that nobody really gives you a second COVID test unless you do it privately. For me, because I got it at work, so I was tested at work, but they said, no, I did not have to do a second test, and I was very, very disappointed in that. So I gave myself an extra almost an extra 1 week, by the way. I didn't go to work for yet another 1 week, even after they said, oh, you have no symptoms. So that's what I had to do on my part. I decided just to take it upon myself to make sure that at least I am completely off of this. So I stopped taking the aspirin, I stopped taking the Tylenol, just to monitor myself for the next 7 days, and that's what I did. So how did I know I was negative? Nobody really told me. I just don't have the symptoms since the time that I stopped having symptoms, and I haven't had those symptoms to date. So if I need a second test, I have to look for private organizations to go and test me, but my work does not test you to verify that you are now COVID negative. Unfortunately, they don't do that anymore. And the thing, if I may add, is that there are people who, after you have stopped having symptoms, that you might still test positive, even though you are really no longer transmitting, or you're no longer contagious. So that was their reasoning. So.
Same question to you, Sister Neema.
Can you repeat the question, please?
Yeah. How long did it take you to know that you've recovered, and what have you done since that particular time? I mean, how long were you sick, and later on, how many days did it take for you to realize that you are okay?
Well, I had to be on quarantine because, as I said, I contracted this disease earlier on than Edith. Mine was in April. And at that time, you had to do 2 tests before you go back to work. So after 14 days of quarantine, I went in for a test and it was negative. Then they said you have to wait, I think, 3 days and go for another one. So I went for another one, which was also negative. So that's how I realized that I was okay and I had to go back to work. And since then, I take more precaution, especially if I am going to be close, especially if I am going to meet people. I put on a mask. I think that it's the masking, and washing hands all the time, making sure if you've touched something, wash your hands, use the sanitizers. And I am kind of very, very sensitive about getting it again. So I try to take more precaution because, again, as I said, I have existing conditions. I don't want to expose myself to it. Initially, they had said that once you get it, you don't get it again. Now it's turned again that you can actually get it after 3 months or something like that. So we have to be very, very, very careful. Masking is important. It's like masking, and washing your hands. That's very, very important. Keeping, if you can, keeping, I think this is another new era now. It's like you have to keep to your house. You have to keep to your family. It's no longer that time when we could go visiting and, I'm trying to keep at home.
Thank you very much, Sister Edith and Sister Mora, for that candid conversation, that the way you have actually articulated the issues on how you got sick and how you managed actually to be okay. And at KDRTV, we also thank God that you did manage actually to fight it, and you are here to tell your story. Let me now take you a little bit back and give you some very discouraging information about some of our friends who have actually had it a rough way because they lost their community members. One of it, as I started actually speaking earlier on, I told you that I've lost a very close friend who was a consultant orthopedic surgeon, Dr. Alushula, the owner of Kakamega Orthopedic Hospital. And not forgetting our 3 elders who we buried recently. That is Dr. Hume, Dr. Nyambane, and Mr. Muteshi. This disease is really wreaking havoc in our community, both in diaspora and back in Africa. And what advice do you give the community as survivors of this pandemic? Let's start with Neema.
Advice is that if you can manage to take your vitamins, that's very, very important. Vitamins D, C, zinc. Eat properly, eat fruit. A lot of fruit also will help you. Exercising and following the CDC regulations. We just have to do that right now. We don't have a choice. We would like to do different things, but the conditions right now do not allow us to do any better or any different. So let's keep to try to eat balanced food, good food, and vegetables. But above all, also have our vitamins.
Same to you, Sister Edith. Go ahead.
So what I can say is we really need to take self-responsibility when it comes to COVID. My heart goes out to anyone who has lost a family member. It's not easy. My heart goes out to everyone who is battling COVID right now, because there are many. We have family and friends who are fighting COVID right now. And self-responsibility for me is
Can you give me the
making sure
information,
that
Junior?
making sure that we all realize that COVID stops with me. Like, what part am I playing as an individual to prevent COVID from spreading? If we start from that, then it's going to help mitigate, the spread. CDC guidelines, they're getting updated weekly, monthly, because again, this is really new to everyone in the world. It's a pandemic. We have not experienced anything in our generation like this, I believe since 1918, generation before. So we have to follow the CDC guidelines. Wash your hands all of the time. You have soap and water to wash your hands for about 20 seconds. Make sure that you use hand sanitizer, but as soon as you wear this water and soap, wash your hands. Disinfect surfaces that are frequently touched. Avoid touching surfaces unnecessarily. Don't touch your face. When you're coughing, if you have tissue, cough into a tissue and throw it in the trash. Don't put it in your pocket. And physically distance as much as possible. And if you think you're not feeling well, I know there's stigmatization going on, and most people, even when they feel a little bit unwell, they don't want people to think that they have COVID because of the stigma that is surrounding it right now. Just don't go to work and say, oh, I don't want people to think that I have COVID. If you suspect that you're sick, please just stay at home. Take self-responsibility. And another thing that is a must do is, of course, wear a mask. Mask. It doesn't matter, as long as you're stepping out of your house, make sure you have your mask with you. And don't use a mask for way too long. Don't use the same mask. You go to Walmart, use the same mask. You go to who knows where, you're using the same mask, putting it back in your pocket, taking it out, using it everywhere. And gatherings. If we can avoid gatherings, that will be helpful. We have birthdays, we have celebrations that people are hanging on to. We can postpone 2020 to 2021. Let's try to survive this. Don't be complacent. Don't let your guard down. Don't say, oh, you know what, I believe that so-and-so is taking care, the other person is taking care as I'm taking care. So you know what, I don't have to wear my mask. Don't let your guard down. We need to just keep pushing. We need to make sure that as individuals, we are taking self-responsibility. The government, especially the US government, I can say is letting us down. We have governments like New Zealand, Taiwan, that are really having success stories in the fight of COVID. But individual responsibility, self-responsibility, COVID stops with me. That's what is going to help us fight this, and at least hopefully eliminate it from society.
Thank you very much for that information, my dear sister Edith. What about you, Sister Mora? Can you also give us some information on how the community is supposed to ensure that this pandemic is not ravaging through it and it is preventable? Go ahead.
I think it's pretty much the same what Edith has said. Let's end COVID with ourselves, just like she put it. Let's not spread it to another person. Let not another person hurt because of you, or another person die because of you. The pain that we are going through right now is big enough. So 1 year of trying to be careful so that we can eliminate this virus is not too long. It's really not too long. So we really need to work together to eliminate this disease. We need to work together to take the necessary precautions, to follow the CDC guidelines, to wash. Hand washing is so very important. Masks important, gloves important where we need them. and keeping away from gatherings also is a big one, because a lot of people have been infected in gatherings, especially indoor gatherings, because there's not enough ventilation or there's not enough air circulation. So birthdays, indoor birthdays, that's a no-no. But even the outdoor, if you can avoid at this time, we need to do everything to avoid, to make sure that we avoid spreading this disease or catching it, or bringing it to a stop, to an end.
Yeah. Thank you very much. Thank you very much for that insight. And again, we are pretty encouraging our community members, especially those ones who are having difficulties in getting housing, difficulties in getting food. We've got a very nice team, especially in our community, called the Amwag Sisters. If you can actually grab their numbers, and then we can also talk to them and help you. And also the Hennepin County is really helping a lot. Their number is 1-844-330-220. If you can call that number, definitely you can really get help you deserve. As we are continuing to discuss again, I'm also going to ask you, as medical professionals, how's the pandemic affected your service delivery at your work or your various workplaces? Sister Edith?
Oh, yeah, well, I know that most people assume that, oh, there's COVID, so healthcare is making a lot of money. That's really not the case necessarily. What COVID has done is that it has created disruption in the healthcare system. We have some hospitals that had to close some units to create room for COVID-related cases. And what that led to was workers being furloughed, some losing their jobs. At the same time, of course, we have cases that are not like urgent cases, they're not like urgent medical cases that have had to be postponed because the units that handle those cases were closed. We have right now the services for doctor visit. That it's what do we call it? Telehealth, where you have to talk to your doctor across. They're not really listening to your lungs. They're not listening to your pulse. So you have to describe your symptoms to a doctor, not necessarily of COVID, but for anything else. So, and not everyone is technologically savvy, and that's how we are now getting service. If you're sick, you call your doctor. You can only go in when it's absolutely an emergency situation, So the disruption is big. It's economically, it's disrupted the healthcare system, and just the loss of jobs for some people because their units were closed. When a unit gets closed, people are like, oh, those people can work elsewhere. But you're thinking about other workers, subordinate staff, who cannot come to work for reasons like a unit really closing down. That kind of disruption has caused anguish for families. It's caused mental anguish, I should say, for many people. And there are cases like if you had like elective surgery or any other elective procedure, you cannot be seen right now. They tell you, sorry, you have to wait, and who knows what will happen if you don't attend to some procedures that may not look urgent, but you don't know what is going to happen to you if you postpone that for so long. Yeah, so it's a lot of disruption in the service industry, in the healthcare service industry. It's a lot of disruption. Yeah.
Can't hear me?
Yeah,
Oh,
now
sorry.
we can hear you.
Okay, thank you. I was saying, Sister Murad, do you have anything to add on top of what Edith has said, or you are okay?
I would add this. In healthcare, it looked like people who were in healthcare were secure, their jobs were secure, their jobs were safe. But with COVID-19, nobody's job was safe. When we saw hospitals being closed down, units being closed down, people were not even allowed to come into the hospital, everywhere was locked. Then it dawned to me that nothing is safe. No job is secure. This has really, really shaken the medical industry. Everything has changed completely. We might end up just being seen, never being seen directly with doctors. Who knows? Things have changed. It's not going to be the same like it was before. So it dawned on me that nothing is secure, nothing is permanent, and we probably have to trust the higher power, trust God, because with Him, things are permanent.
Thank you
There's
very
nothing.
much. Yeah, go ahead. Go ahead. Finish your statement. So
I was just saying
nothing
is permanent. Not even hospital jobs are permanent. So if you have a higher power that you trust, like I do, that's what I'll cling on.
Thank you very much. And once again, the number, the Hennepin County Resource Helpline is 612-348-300. I repeat again, 612-348-300. Thank you very much. So let's go. We are almost done with the questions, and I would also love you to tell me if you believe that the government is really doing enough to ensure this pandemic is defeated. Let's first of all focus in America before we go to Africa, or if politics are at play to ensure this pandemic is actually defeated. Let's start with the Sister Edith. Do you think the government is doing enough to ensure that COVID-19 is defeated?
Well, I have to say that the government actually has a very critical role in fighting a pandemic, but our current government unfortunately has created a situation where there is no cohesion in the messaging for COVID-19. We have a leadership that is fighting with the CDC, with the World Health Organization. When there is no cohesion in a fight against something like COVID, which by no means should be politicized, because COVID affects all of us, it's affecting all of us. It's not choosing who to affect. It's not a disease for certain people. It is affecting all of us. So for that reason, the least you'd expect from a government is a message that is cohesive, a message that is concrete, that is concrete, that is very clear, that is precise, that will actually motivate people countrywide to, a message that will motivate people to take more self-responsibility in fighting the COVID-19. So the government's role is critical, but at the same time, I cannot say that our government has actually done well, because there is conflicting information. You have a leadership that says masks are not important, and then you have CDC that's saying put on your mask, and this kind of messaging is what is making the US especially have numbers increasing by the day. At one point we thought we had this thing contained, but just last week our cases are going up again. And so if we cannot have COVID as the enemy and the fight against COVID as our ammunition against COVID, and then now we have COVID as a political issue, then I can say, unfortunately, that it's really going to take a long time before the US finally succeeds in the war against COVID. Unfortunately, yeah.
Thank you very much, Sister Edith, for giving us a candid observation about how the government is trying to fight this pandemic. And Sister Mora, do you think, especially the governments in Africa, are really up to the task to ensure that this pandemic is defeated?
I think they're trying, but I don't think they're doing a good job, especially when they misappropriate funds that are meant to go towards COVID and towards helping people. They have, like in Kenya, I think that they have the mask rule. A lot of people are really trying to have masks on, and that I think has helped the numbers go down. But I wish there wasn't so much corruption everywhere, because if there was no corruption and the money appropriated for a certain purpose is used towards that purpose, it will help reduce the numbers. Our people don't so much as have running water everywhere, but people have tried very hard. They have made some makeshift pots to, where people can go wash their hands and stuff like that, which is really, really helping. But our government in Kenya, our governments in Africa need to, I don't know when this corruption will ever end. I mean, how does money meant for people who are sick and dying get diverted into other things? It just means we don't have a heart. We don't really care for other people. We need to be more caring. We need to not always think about ourselves. But unfortunately, some people just think about me, I, and myself. So that's all I can say.
Thank you very much. Sister
and
Edith, you wanted to say something. Go ahead.
No, just like I like what Nema said, the efforts that have been made by individuals, back home in Kenya, where they have these makeshift tanks for washing hands and stuff like that. You can imagine what would happen if money that has been given to a country is actually channeled for the purpose of fighting COVID, making sure that people have masks, that the hospitals have what they need. But at the same time, when it comes to government, again, my disappointment in most governments in the world right now is where governments at this point, when you have a pandemic, something affecting countries all over the world, you'd expect that they would actually come together and have a fight that is unified. And another thing that countries need to learn from those countries that have actually succeeded in fighting the virus. Learn from New Zealand. What New Zealand did is that they made screening for COVID easy, contact tracing, isolation. They did the lockdown. They persevered with the lockdown. I know some countries did not have to do lockdown, like Taiwan, I believe, did not have to do lockdown. But of course, they have an advantage because they're an island. That helps. But it doesn't mean that if you're not an island, you cannot have borders and port of entry screening. You still have that, because even when you're not an island as a country, you still have, if people are coming in, you should still be able to screen the people coming in, whether it's at the port of entry or whether it's at the whatever the borders are. So governments should learn from those countries that have succeeded, but at the same time, we really need a concerted effort of all governments coming together. That's what we don't see. So I don't know if it's because the US is not taking a lead, because the US used to always take a lead when we had issues like this, where countries come together. The World Health Organization should be, at this point, be getting support from all countries, but unfortunately it's not. And that's why I go back to self-responsibility. If your government is failing you, what are you doing as a person to make sure that the COVID is not spreading? Yeah.
Thank you very much, Edith and Mora. So our last question is going to be on, on your on encouraging immigrants actually to vote. So as community leaders, you know, both of you are senior community leaders, and Edith is having a position as a leader in the community. She was actually elected, not endorsed, but she was elected, or I mean, she was not handpicked. She was actually elected by the community members to represent a big chunk of, let me say, the county of Dakota County. She's actually a leader of Dakota County. So what I'm going to ask you a very passionate question about voting. Right now, it's now like 2 days to elect. I mean, to voting, official voting. But I believe that so many other people have already voted. So do you encourage immigrants to vote, and what does this mean to them as the day is approaching? Let's start with Mora.
Well, I'm going to encourage everybody to go out and vote. It's very, very important to be able to get a government that is going to work together with the science, with the medical people, and take advice from the medical people, not fight them and tear them apart, and we end up getting no results. As my sister Edith put it, cohesion is very, very important. If the government works with the CDC, works with the people who know about this sickness and prevention, it will be easier to eliminate this disease. We cannot go out there and tell people, no, you don't need masks, and CDC saying you need masks. So please, our people, go out there, vote. We need a government that is going to bring people together and unite people and work together with the CDC to eliminate this disease.
Thank you very much, Sister Neema. Edith, your take.
Oh, well, at this point in time, I cannot stress enough the importance of voting. We need to vote like our lives depend on it, because our lives depend on it. If you're not eligible to vote, ask a friend who is eligible to vote. Ask a friend to ask a friend who is eligible to vote. We all must come together. What we need to fight for at this point in time is eradication of COVID. COVID has disrupted our lives in the world, and people might say, oh, the economy this, the economy that. There is no economy if COVID is still here. There is no good economy, I should add, if we still have to fight COVID. So when you are going to vote, and of course it's not my job to tell people how they're going to vote or who they're going to vote for, but I can urge people to just take a moment, ask yourself, this person that I'm trying to vote for, whoever it is that I'm choosing to vote for, what do they stand for, especially with regards to COVID at this point? Ask yourself, is this person that I'm voting for willing to face COVID and fight COVID to bring COVID to an end? The person that you're trying to vote for, are they willing to learn from success stories from governments that have succeeded in the fight against the COVID-19? Ask yourself, is this government is this person or whoever it is that I'm trying to vote for president, are they willing to listen to the science? Are they willing to accept that it's through science that we are going to find ways to actually finally fight this virus and bring it to an end? Are they listening to the science? So ask yourself those questions. Don't vote just because you're emotionally attached to someone. Ask yourself, what is this person that I'm voting for going to do to bring this country together and not politicize the coronavirus and make the coronavirus a political issue? I don't even understand when the coronavirus became a political issue in the first place. it's just mind-boggling. You'd think like everyone would be like, oh, this is a virus, it's affecting humans. Like what can we do as human beings to fight this virus? It's not about scores of who is wearing a mask or who is wearing the biggest mask and who is not wearing a mask. What can we do as immigrants to fight this virus? Self-responsibility and choosing the right leaders. If you don't have the right leaders, we already have seen what it means to have a leadership that is not focused on fighting the coronavirus. So
Thank you. Thank you very much. Yeah, I really appreciate you two coming and giving us a story or telling the world on how you have actually managed how you did manage to fight COVID-19, and you did actually come out successfully. And I can tell you that from the messages we are actually receiving on Facebook and YouTube and Twitter, most people have really said kudos to you too, to have actually managed to come and actually tell us this story. And again, I'm getting a very passionate message from Dr. Jacqueline Nyaberi, who says that at least ladies have actually shown the way. Where is a man also to come up and actually tell his story and say, okay, men are also there, they are watching, so let's also get somebody actually also to come and tell his story, especially from the men's perspective. So, men sometimes are a little bit hesitant or a little bit shy to tell their story. So it's a point at you men to ensure that at least one of you also comes and give a story. At KDRTV, we are pretty open to discussions. We don't really choose people. This is a TV for you. You give your story. You come with your stories. You give your opinion based on science. We don't actually just want opinions which are guessed, which we just basically guess, but we want opinions which can transform the community. And the other thing we guys, we have not actually really touched so much is about parties. I remember I got some information yesterday that there is somebody who is really battling COVID-19 in the ICU in one of our local hospitals. So, Sister Edith, what do you tell the community, especially this particular time when we have actually seen the cases now spiking up? We thought the COVID-19 has been contained, but right now we are seeing spikes, not only in America but also in Kenya. So, can you tell us a little bit on this? Can you give the community your opinion on what do you think they should actually be doing at this particular time when the cases are spiking? Go ahead.
So what I can say is, please, parties can wait. Parties can wait. Once you have COVID, you do not know how it's going to turn out for you. It doesn't matter whether you're young. Young people have had strokes because of blood clotting, once they get COVID, and then they have ended up dying. So do not let your guard down. I have said this before. Birthday parties, whatever parties that are bringing people together can wait. Do not go out in the public unless it's absolutely necessary. Leave your house, go to work, go back home. If people are gathering somewhere, avoid gatherings. I know people say, oh, everyone is going to put on a mask, but you realize that when you have parties, people are going to have to eat their food. And if you're going to eat your food sitting next to someone who is talking to you, and you don't know whether they're actually asymptomatic and they're spreading the virus, that's how people are getting this virus. We can't let our guard down. I've said that before. So this can wait. We can comfortably write 2020 off. We should. 2020 has not been kind to most of us, to many of us, to the whole world, really. So let these parties wait. We can have parties next year, hopefully, if we and another thing that we need to do is pay attention to where the statistics are. Listen to the news. Is COVID increasing in your area? And if it's increasing, just know that the chances of you getting or contracting COVID are increasing with the increase in COVID in your area. So when you see Minnesota is red on CNN, please just know that red means that red is coming close to you. So don't go to these meetings and gatherings thinking like, oh, it's not going to affect me, or maybe the media is exaggerating. It's not exaggerating. Go to CDC website, look at what the numbers are, you know, if you don't believe the news coverage. If you hear that COVID is increasing in Minnesota, please understand that it's increasing and your chances of contacting it are narrowing down. So stay away from parties, stay away from any gathering that is not a do or die. So just stay away, you know, stay away from all these parties. It's not necessary at this point.
Thank you very much, ladies. Thank you very much for your time. Now I'm going to give each of you 1 minute to do a closing remark. 1 minute to do a closing remark or to wrap it up. So let's start from Sister Neema. Go ahead.
Just like Edith said, let's keep away from these parties. Let's keep this CDC regulations. Let's wash our hands and let's go out and vote.
Thank you very much. Let's now go to Sister Edith. Edith, your closing remark, please.
My closing remark is, don't forget that COVID stops with me. That's what we all really have to say. COVID stops with me. Do I have my mask on? What role am I playing to prevent COVID from spreading to other people? COVID stops with me. Number 2, vote, vote, vote. Vote like your life depends on it. If you do not if you're not eligible to vote, please find a friend who is eligible to vote and ask them to vote. And do not forget that this year we are voting for a leadership that will get us out of this mess called COVID. Once we have COVID out of the way, everything else should fall in place. And thank you so much for listening.
An opportunity to come and tell your story. Both of you are COVID survivors, and we thank God for you to have had an opportunity to come and tell your story. And once more again, for viewers, thank you for having an opportunity to watch KDRTV. We are really encouraged by your messages. We also need messages to ensure that we grow. We need you to criticize us. We need you to tell us on how we can actually improve. And furthermore, I mean, our story is basically being told by you, and the best option is at KDRTV. So if you have a time, if you have a minute, please follow us on Facebook. Go to YouTube and subscribe. Go to Twitter and like our page. So this is how we can actually grow as a community. We are here to share information. We are here to tell our stories. Till next time, when we'll be having another live view or interview, not only on COVID-19, but on various topics affecting the immigrant community, affecting people in America, affecting people in Africa and Asia. We thank you, and may God bless you. Till next time, I'm your host, Omweri Kebwato, from Shakopee, Minnesota. May God bless you. Let's meet again in the next interview. Thank you very much, and goodbye.